Diabetes in women is much more common than we realize, and so being able to detect early signs of diabetes can be extremely helpful. As per international statistics of 2021, 9% of women in the world's population have diabetes, and the prevalence in women in India is 11.7%. You'll notice most cases of type 2 diabetes among women older than 45, while gestational diabetes usually occurs in women during the childbearing age. And even though most symptoms of diabetes are the same between men and women, some symptoms are unique to women. And today, I, your SugarFit health coach Venus, will be discussing the signs of different types of diabetes in women so you can look out for them early on. Let's start with type 1 diabetes and its symptoms. When it comes to the symptoms in women, they don't come as quickly as they do in men and actually require careful monitoring. Some of these symptoms include feeling the urge to take frequent bathroom breaks due to increased blood glucose levels in the body, feeling thirsty as a result of frequent urination that causes dehydration. The dehydration can also further result in the itchiness on the skin. Due to increased levels of ketones in the body, it could also turn your breath fruity. Another symptom to look out for is vaginal yeast infections. It is caused due to the increased glucose levels in the body and can result in itching and pain. If left untreated, it could also cause vaginal discharge. You might also notice some unexpected weight loss, blurry vision, and even nausea and vomiting. If you notice these signs, I'd strongly recommend you get tested. Now, let's look at the symptoms of type 2 diabetes in women. When it comes to type 2, there's a decreased sexual drive observed among women. The reason behind this is vaginal dryness caused due to diabetes. Another common symptom is urinary infection. You become more prone to urinary tract infections as the high levels of blood sugar increase the growth of bacteria. This happens as diabetes causes the bladder to retain urine, and you will notice pain while urinating. You'll also notice burning sensation in the vagina and sometimes even blood in the urine. The third symptom women can look out for is irregularity in menstruation. Diabetes can cause hormonal changes in a woman's body, and due to imbalance, those with type 2 diabetes can experience irregular periods, decreased flow, and no ovulation. That's not all. Women are even prone to developing polycystic ovarian disease. The third type of diabetes is gestational diabetes. This is usually experienced by women during pregnancy when the hormones interfere with the functioning of insulin, and these changes in the body can lead to gestational diabetes. You'll notice symptoms like dryness in mouth, frequent urination, vaginal infections, increased thirst, blurry vision, and feeling of tiredness. Now that we've discussed the symptoms, let's also quickly look at the risk factors for diabetes in women while we are at it. Some of these include being older than 45 years of age, being overweight, having history of diabetes in the family, a lack of physical activity in day-to-day life, with high blood pressure or high cholesterol, history of having gestational diabetes, giving birth to a baby who weighs over 4 kgs, having a history of heart disease, having experienced an injury to the pancreas, excessive physical stress, and other medical issues that impact insulin like PCOS. So to conclude this episode, the few unique symptoms in women usually involve the reproductive system. These symptoms can also affect the fertility in women and her unborn child. Unfortunately, women also possess a greater risk of developing complications to diabetes in extreme uncontrolled cases like heart disease, kidney disease, blindness, and even depression, which is exactly why we need to realize the importance of the symptoms that will help in early detection of diabetes. The longer you leave it unattended, the worse it can get. For more such details, please subscribe to our channel. Take care.